Hello, good afternoon. It's the 17th of August 2024, and this is the weekend of our class reunion and RCSI alumni. I'm joined together with my two very good friends and classmates, as well as house buddies, Marc Ghany, Dr. Marc Ghany, who is currently working in Washington as a gastroenterologist with a specialty in hepatic diseases, and Mr. Marc Ho-Asjoe, who is a plastic surgeon in London, who specializes in everything to do with plastic surgery. It is now 35 years since we finished and qualified. Although we've gone in separate ways, we've come back together, we kept in touch. And just like we were walking around the college yesterday, and one of the things we talked about is our first day back when we got into the admission day and how we all met. Marc, would you like to just tell us how we first met up?
I mean, it's extremely embarrassing. I mean, I think the first person I met was one of our very good friends, Stephen, who was just standing behind me in the registration queue. Get start talking. That was it. Next things was being late for lecture as usual, and another of our housemate best friends has his back sticking out a little bit on a lecture theatre and walking in trying to make a quiet entrance, trip over his back, got the whole class turned around, has to sit down immediately to hide my face, and then end up talking to him and talking to you guys, and since that day pretty much best friends. And yeah, that's it really, is that?
That's right. It was the very first day and everybody was quiet.
Yeah,
you came in late besides, and there was the whole thing.
Yeah, I have to say that somehow we hit it off right away. And I think part of the reason was we all decided to go to Rice's for lunch, and Mr. Rice ended up closing up the pub and left us in there.
Yeah, that was known as Holy Hour.
Holy Hour, that's right.
I think it's something which doesn't exist anymore.
I don't know if they still have Holy Hour, but I think that's how we all gel together. Mm-hmm. And we actually lived together for 4 or 5 years, and then we've remained really, really good friends. So it's but I have I wanted to ask you guys what memories did you have of that first week of college? Because there were definitely some
I do remember
some
Marc
important ones.
I do remember Marc being tripped, but now that you've mentioned Rice's, I think I remember very clearly. Remember that what they had
the three-legged pub crawls.
The three-legged
pub crawl. That's,
yes.
And Mike Duplessis was the winner with Margaret.
Margaret setting a record as well.
Yeah.
I don't know. Do they still have the pub crawl, Dave?
I have no idea to tell
I'm
you.
not quite sure they can lock down the whole St. Stephen's Green traffic for a whole bunch of drunk medical students running around the whole centre of Dublin. I mean, those were the days that you suddenly realised that the Irish are so loving, tolerant, and friendly, and just a whole bunch of foreigners making chaos.
In white lab coats.
Yeah,
white lab coats.
Tied together. I don't know what people probably thought of us.
Yeah, I also remember after the pub crawl, a group of medical students from Trinity would come up and knock on the college front door. You remember that?
I don't recall that, but probably I had too many beers at that point to remember anything.
But I think that's the thing, is that the whole college experience just got so many great memories. If you ask me, was there any bad memories? I can't think of any. It just was probably the most wonderful 6 years of my life. Okay, obviously, I forgot to tell my wife that marrying to her was the best things ever. But in reality, that 6 year was just wonderful.
It was a grand time. But I wonder if I could ask you, Marc, how did you make the decision to choose medicine as a career and come to RCSI?
That's a very difficult question to answer, because I think ever since I was a kid, I wanted to be a doctor, and I wasn't quite sure what influenced me. It was like, it was just one thing I wanted to do. My dad always told me, he said he has never seen a kid who tell him very young age he wants to be a doctor, despite the fact that I was really not anyway, because my grandfather was a GP, but he died when I was 1 year old. So I'm really not very well connected to the medical world. And coming to RCSI partly was, I think it's just the Irish Catholic things. I mean, the first person I met was a priest on Gardiner Street. I mean, it's like my grandmother said, you need to go and see the priest on Gardiner Street. And it's like, okay, the first person you meet in Ireland was a priest.
And Dev, how about you?
I always wanted to be a doctor from the get go, and what you call the school I went to was actually run, just like what Mark said, by Catholic priests. So there was a strong connection to the Catholic ethos of teaching and education, and College of Surgeons is well known. There are a lot of doctors in Malaysia, where I come from, who are all qualified from the College of Surgeons. So I always aspired to study medicine in the West, and College of Surgeons was a no-brainer.
Well, I actually learned something today. I didn't know that both of you all were influenced by priests, because I'll tell you my story. So I originally didn't want to be a doctor. I wanted to be
an actor.
A rock star.
Hardly.
Well, you do great impersonations, I remember, when you're in college.
Yeah. Van Halen, that was it.
That's for another day. I actually wanted to be an oceanographer, because I was very influenced by and enamored by Jacques Cousteau. That was around when we were growing up. And he was an incredible role model. I remember after seeing his documentaries, I grew up on an island, and I was drawn to the sea, and that's what I wanted to do. And then my parents one day sat me down and said, "Well, what do you want to do career-wise?" And I said I wanted to be an oceanographer. And they said, "Well, that's all well and good, but how are you going to make a living doing that?" And so then, my dad was a doctor. His uncle was a doctor, so I'd come from a line of doctors, so that was kind of like the default. But the connection that I just learned was in choosing RCSI, our family priest was from Ireland, and he said, and then my grandfather's Irish, and he said, "Well, have you thought about going to Ireland to medical school?" Trinidad didn't have a medical school at that point. So, and that was the time actually that Margaret Thatcher was prime minister, and she didn't want foreigners to come into England. So actually, applied to our family priest made the connection to RCSI, and that's how I ended up. So we all have the same. We all have the same connection, and a priest connected us to medical school.
One thing I do remember quite clearly is the Trinidadian West Indian accent rhymes a bit like a Cork accent.
Does it? Okay.
A lot of people used to mistake, yourself, Anand, Jared, who are all from Trinidad, from Cork.
Well, it's a bit of like a Welsh accent, because it's a bit sing-song accent.
Welsh.
Yeah. So that's really interesting.
Yeah, I think throughout our youth, we're influenced by different people. And as you say, why we went to medicine, there's something that makes us click. And how we get into our specialty, that's another story. One of the coolest person that I've met in my life is your father, who is just such a cool man and so gentle. And just say, wow, psychiatry is a very good thing, except I really don't understand it. I think you just need a lot of brain. And how you went to GI is like, that's quite different. One is a little bit more practical. One is more of a academic approach.
Well, having lived with a psychiatrist, I knew that was one subspecialty that I was not going to. So
when we were living together, do you think it actually influenced our choices in our career and our specialties, and do you think it actually helped in terms of studying and passing exams and so forth, or did it just hinder because we're just trying to do something all the time where you're distracted from actually getting on with the work of it?
I would say actually that it did help, because we all helped each other, right? Studying, we would we would test each other and
wind each other up with sort of minutiae of that book. It's like page 78 in that corner.
Especially for card signing.
Yeah, exactly. You'd bring a bone out and say, "Okay, tell me, is this a left or right?" But I think actually we sort of fed off each other. But to your question, did it help influence our career choice? Probably not. Actually, from third med is when I had an interest or developed an interest in doing gastroenterology. I was always interested in the fact that it was a procedural subspecialty, and also it did require a bit of thinking to figure out the diagnosis. So from a very early stage in my medical career, I realized I wanted to do gastroenterology, but then my love for hepatology didn't happen until I encountered my first mentor, who actually was from Hong Kong, Anna Locke, who was just simply amazing. And it's incredible how one individual can really influence your life.
Sure.
And
Yeah.
she got me involved in research, and that was it. That was it.
Yeah. But you were quite organized, because in third med and fourth med, you already had a view of going off to States to complete your training and your specialty interests. And you sat for the USMLEs all at the right time and so forth. Like the rest of us were kind of like
which is
literally happy go, kind of took it as it came along. But you were the more organized one of the lot of us.
Well, I always knew I was thinking of going to America to do my postgraduate training, just because having worked there as a medical student in third med and then fourth med, the postgraduate training, the undergraduate training here in Ireland was brilliant, and I wouldn't trade it for anything. But the postgraduate training is much more structured and organized, and you have so much more opportunities. So I always knew that I wanted to go there at least to do the training part. My plan was always to go back to Trinidad, but then having practiced in America, it was really difficult. You just don't have the same resources to be able to do that. But what about you, Marc?
Yeah, because you kind of left for exactly almost like about 10 days or so after you qualified.
Yeah, I mean, the thing is that I always knew that I wanted to do surgery. Probably not bright enough to do medicine, and general practice is really not for me. So, but I didn't know what I wanted to do. And I think after 6 years, and I think at that time you hear you're going to the States, lots of our Irish classmates going to the States, and everyone's going off somewhere. Just say, well, maybe it's time to move on to another place. I think in your 20s, you want to explore different area. So that's why I moved to UK, just to see, just a different country, see what it's like. And then I came back to do the fellowship exams, and then I said, oh, what do I want to do? I want to do surgery, but I don't know what type. So during my rotation, I discovered plastic surgery, because that was the time when plastic was truly booming with all these new free tissue transfer. And I said, wow, I've never seen anything like that, because when we were in medical school, we had skin graft. Now we suddenly have this thing, you can transfer tissue, do microsurgery. I said, this is really exciting. And so that's why I decided to pursue that career. And same as you, I said, well, I'm going to have a few years and go to Hong Kong. Then went back to Hong Kong to check it out and realized that Hong Kong is very backward in microsurgery. Partly is the old system that the professor of surgery decided what need to be developed. And he's the old school that say plastic surgery, not important. So therefore, they never allowed it. I mean, even in Hong Kong University, the plastic surgery is under an ENT surgeon. So they could never do anything big or have any decision. And that is why I continue being in UK. And then after a while, you just say, well, okay, I'm having a career here. I do a few more years, and then a few more years. And then
before you know it,
I'm thinking retirement.
But Marc is very modest. He got the gold medal in his FRC exam.
Exactly, that's right.
But Dave, tell us about you. You're the one that decided to stay in.
But before I go on to that, I do remember, because we associate Marc quite a bit from after we first qualified, because Marc and David Morgan were in the UK, so we would meet up. Then we lost touch for a little while, but I do remember suddenly seeing him on YouTube doing a operation of re-implanting a thumb.
That was a TikTok and dancing. That's all.
All right. Yeah. Well, I always wanted to do surgery, and I was always toying. I always was interested in pediatric cardiac surgery. So because it is very underdeveloped back in Malaysia, whereas so I got into the surgical training program here at the RCSI, did my basic surgical training here, and then went on to do my higher surgical training in cardiothoracic here and in the UK. I did go back to Malaysia for a couple of years to work for the government service, but then after a while, I got convinced to come back by my fiancée at that time.
Was it career or love that brought you back, or both?
It is a bit of both, actually, but I would say I would tend more towards the personal life, which brought me back to Dublin, and then stayed here ever since. And fortunately, did all the right things. And now, 35 years later, just like Marc, I'm starting to think I'm looking at the other side of the career now.
Well, but you also now move on into more academic training things, which you find very exciting. It's a new chapter now.
It's almost like a new kind of refreshing change after doing something for a very, very long time, which after a while, it's not to say it gets mundane or stale or anything. I think it just rejuvenates, and you're seeing life and reflecting upon your practice from a different point of view.
I think also for your part is that cardiothoracic is very intense, long hours and unpredictable. Right. And in addition, I mean, you now gain 35 odd years experience. It's time to pass on to the next generation and just say, seriously, I've done that before. It doesn't work, okay? Don't even think about it. Because same as when we were young, we sort of think that like, oh yeah, I mean, those old guys, they don't know what they're talking about. I can do it. And then suddenly you realize that actually he's right. He's done it before. He knows it doesn't work, but you think you're just smarter.
Well, that's the innocence of youth.
Yeah.
Right? So.
Yeah. And so, Marc, if supposing somebody now...
Which Marc? There's two Marcs.
Yeah. Marc Ghany, or Professor Marc Ghany,
hardly.
to use his title appropriately. I mean, supposing what kind of advice would you give to budding young medical students or young trainees now who want to go down the path of hepatology or gastroenterology?
Well, for whatever field of medicine, I think whatever you do, it's not even medicine. It's any career choice. You have to be passionate, I think, about what you want to do. If you don't enjoy it, if you get up in the morning and you think it's a chore to go to work, then that's not for you. You haven't found what's right. I mean, you have to be passionate and completely embrace it and all in.
Yeah, that's true.
If you want to be successful in something, and then obviously, finding the right mentor is critical because it's important. I mean, you still need somebody to hold your hand, and take you through the process and open doors for you. So I would say, be passionate, find the right mentor, and then work hard. I mean, that's really the recipe for success. And then you have to have a little bit of grit. If you fall off the horse, you got to get back on. Sure, you can't let that be a...
Yeah, that's the real thing now, isn't it? The resilience and the resolve to actually, learn from where you went down, what was wrong, or a sort of semi-failure, or when a door closes in front of you, how to get up and go to reopen the door. Because nowadays, everybody expects everything to work perfectly.
Yeah.
Yeah, I mean, they've actually looked at very successful people, and that the one common trait is grit.
Yeah.
These are people who don't take failure.
But also, I think
you use as an opportunity
you learn
to learn, right?
You try.
Yeah. Is that the psychiatrist talking? Because if you don't get your reward the first time, you try and try again.
It will get you there one day.
Eventually, at some stage.
So let me ask you, Dave. So at this point in your career, what do you think has been your greatest achievement?
Oh, God. I think, for a start, I think I've been blessed. I've been really, really lucky. I've had friends like you guys. I've got a really fantastic family. I've had good family support. To actually be away from home for so long, and still have the support and connection. So I think I've been blessed in that sense. So, and I've been lucky in the sense that I've always had some new challenge happening all the time. I was fortunate enough when I went back to Malaysia, we had to be involved in part of a group which carried out the first heart center in the south of the country, and when we catered for 6 million people and worked really hard. And then when I came back to Dublin, I was part of a fantastic team which led the lung transplant program. So I was one of the doctors who actually carried out the first lung transplant in this country in 2005. And then on top of that, in terms of career-wise, I was fortunate enough to become one of the commissioning surgeons to start the cardiac surgical program in Galway at the University Hospital in 2007. So I think I've been blessed in having all those kind of highs in my career point. At the same time, like I said, it couldn't have been done without the wonderful support I get from my wife Deirdre and my family as well. And then at the same time, I think going through surgeons, to a certain degree has almost been your life. I know you guys left, and I stayed here. But then if I hadn't been here, I wouldn't have met you guys. I wouldn't have met my wife. I wouldn't have had my career. So I think it has been part of my entire fabric of life.
Yeah, I mean, I would say to your point about RCSI, I mean, I think this was a wonderful place to go to college. And
it's a fun place.
Yeah, the experiences we had, I'm not sure we would have had at other medical institutions.
I mean, that's the thing. I think I'm just fortunate to stumble upon, to come to a wonderful country where the people are extremely welcoming and very friendly. And it's just a great city to spend your medical school life, and to have so many people from different countries. I always find that two things I found when I graduated. One was that I genuinely feel the undergraduate training from RCS was amazing. That when I first doing my house job in London, I just say, these guys have know nothing. I mean, what I got taught was way better than that.
That's right.
And the second thing is that during my time of training, the support from other people who graduate from RCSI, the minute you just say, I'm from surgeon, and they just say, wow, wonderful, I'm from surgeon too. And they really try to give you this supportive hand. It's just it's like a brotherhood, sisterhood, whatever it is, like that. Other people don't seem to get, even though they're all from Manchester or Cambridge, it doesn't really matter. But there's something bond us together with RCSI is amazing.
Oh, definitely without a doubt. I mean, like I have siblings who are in the medical line, and over the years, I've always met people who graduate from other colleges in other countries, in other places and all. And definitely you could see that there is a slight difference from graduates of the college compared to other places, and definitely there is variety, there is diversity, and there is camaraderie. I mean, like last night for the class dinner, I mean, this is 35 years out, and we had almost 60 people.
Yeah,
that's a phenomenal turnout. For a group of students or graduates who had not met each other for a long time, and to come back and just gel and chill and find that as though there was no what do you call barriers.
Yeah, I wanted to pick up on the point you made about Marc, about the Irish, and I'm not saying that because I have Irish heritage. It's I think that's so absolutely true. I mean the real strength of Ireland is its people. I mean they're so warm and accepting and friendly. And I vividly remember two instances. One, when we went to Waterford for our rotation.
Oh yes, that's right.
We went. We went to the place and we were staying and put our bags down, and we went to look for the local pub, and we walked in the door, and before we could reach the counter, the publican had pulled 3 pints and said, those are for you guys. Those lads over there ordered them for you. I mean, what other place in the world does that? Thanks. And then the time we went down to Wexford.
Oh yeah.
And we went into this hotel, and we said we were going to look for a drink, and there was a wedding going on, and they told us to come join the wedding. We wouldn't even dress. I mean, those memories. I don't think you could have had that experience anywhere else.
Yeah.
I mean, the only thing I've got to complain about Ireland was when I first came over here, it's like you talk to people and they say, the man there, I say, what man? They're talking about a curtain. And they say, the man, which man are we talking about? They're trying to get used to the slang. It was just like, oh my God, it took me forever to understand what they're saying.
For me, it was always the weather. Yeah. I mean, having grown up in the Caribbean, where it's you see the sun almost every day, and you see the beach, and here it's like I could count the number of days.
Yeah, but when the sun shines here, it is perfect.
Yep.
But that's the thing, is that you need those horrible days to make everything looks even better.
But no, it's I have absolutely no regrets about coming here, and it's great to be back. And as you say, to connect with people. And there's some folks I actually didn't recognize. Some of our classmates.
Yes.
It's like 35 years since I last saw them. But once you make that connection again, it's like you never
it all
left.
comes back.
But also, there's so many memories that bring us all back. Say, do you remember that? Do you remember that? And everyone starts saying, yes, I remember that. That was so funny. And it's just there's so many instant.
Yeah, but our class was something different as well, because I remember, when we qualified before the graduation, I think it was a Saturday, and we had a party in in the back garden, and I think almost
that's huge amount.
Exactly, at least 3/4 of the class turned up for that party, and it was the FA Cup final, and Liverpool won. That's why I always remember.
That was a bad day. That was a bad day.
I'm sure you would have erased from your memories.
But I mean, the person I truly have to thank to graduate from RCSI is really Paul McCormack. If it wasn't for him sharing his notes out to the whole class, I mean, I wouldn't have passed epidemiology. I'd probably still be in college now.
No, that was the our classmates were definitely very helpful to one another and friendly, and there was absolutely no animosity.
But that's the thing, it's like willing to share.
People were competitive, but still willing to help each other out.
It's a healthy competition. It wasn't a malicious kind of competition at all. But it's very, very healthy competition, and there was definitely a thing of a shared experience, because you found it hard. And then it kind of, if you bounce it off somebody else, it helps you recollect as well and make you understand it better. It's much easier.
Yeah. And unfortunately, we've lost a few of our classmates.
Yeah, that's very sad.
Which was sad. And part of the reason that I came back to this reunion is because we're getting up in age now, and things begin to happen, right? And I really wanted to see people when they were still healthy, and you could have good conversation, good crack. And just reconnect.
That's the Irishness of you coming out now, the good crack.
The good crack. Suppose it's a word you still use quite frequently in America.
Yeah, it has different connotation in America, I think.
Yeah, don't talk to the guy just around the corner.
Do you spend more time trying to explain?
So any regrets you have?
Regrets? Not at all.
Something that you didn't do that you wished you had done.
Let's see. In terms from the college days, no. In terms of career-wise,
seems like you've done a lot and achieved a lot.
I don't. I'm trying to think what would I do career-wise, which would have made me any better. I think if I could, one of the things is, you see, training and studying and working and all is very streamlined. You have to do so much, you can't actually stop. I think, if you look back now, I think if there was a time where you could take time off and work in one of the underprivileged places, completely underprivileged, like working for Medical Sans Frontières or so forth, or even doing humanitarian work for a short while. I think if I could have done that somehow along the line, I think that would have been fantastic. And I don't know now whether I could do that, because I think it's all very structured and very political and so forth. In fact, I actually went for a course where you could try to help in humanitarian work, and it is actually very, very so streamlined.
Really?
It's almost like going back into complete surgical training again.
I would have thought that they were, they would have really accepted,
no, there are a lot of connotations.
Your expertise.
No,
And,
there are a lot of things in terms of psychological, what do you call it, awareness of how to treat, how to deal with people in such areas, and then there's also resilience training and also safety training and so forth.
Sure.
And because you see, you're bringing expertise of where there is everything works, and else you're trying to work in places where there's not enough operating equipment and tools and so forth and stuff. So you're working in a different areas. So even to cope with that is not that easy. So I think that's the only regret. If I wish I could have somehow incorporated that in my career, I think it would be perfect.
But then, I mean, from the point of view of do those things, I mean, I'm slightly different thinking. It's like, I mean, what you are doing now is more educational. I mean, I think the whole world knows that, you can go to all these places, do the surgery and leave, but you're not really leaving the people with any knowledge or anything. You just feel slightly God syndrome in a sense that you go in and save someone, but actually not doing it. But educating people, that's what you're doing now. It's actually probably more important and more useful.
Right. Teach a man to fish, right?
Yeah,
and
that's the thing.
He'll eat for life, right? As the saying goes.
Yeah, I mean, that's why we have now, I sort of do a little bit of work with some charity that they fly surgeons in and they watch us, and we sort of just tell them everything we know, and hopefully they pick up some new tips and to go back, rather than the old ways that we just go do and leave, which doesn't make sense.
Yeah, to your point, where I work at the NIH, we now send doctors out to impoverished areas, low and middle income areas in the world, and try to
send some to UK, London.
Hardly. Try to as you say, disseminate the information and try to improve the health and care of those the populations in those countries.
Yeah,
because I think it's important. That's how you basically elevate communities and try to bring parity.
Yes, also prevention is better than cure, isn't it?
For sure.
You've made huge headways in research. Tell us a little bit about what you're doing in hepatology now.
I would have to say that I was really fortunate to enter hepatology at the time that hepatitis C was just being discovered, and when we were medical students, we learned a little bit about it. It was called non-A, non-B hepatitis, if you remember.
Yeah.
And it was still called that even when I had graduated and we were practicing. And then they discovered the virus in 1989 through reverse cloning, and shortly thereafter, a test was discovered. And actually, when I moved to the NIH, I had the opportunity to work with Javi Alta, who got the Nobel Prize for Medicine in 2021. And Javi had been working on hepatitis C for a number of years beforehand. And he had these pedigreed cohorts of patients with post-transfusion hepatitis. And we always thought it was due to hepatitis, a viral form of hepatitis. And no one had been able to break his code. He put together, these pedigreed samples, and everybody said, "Oh yeah, we have a test." And then when they cloned the virus, they developed a small protein to look for it, and they correctly identified every single test of his. And then we knew what the cause of post-transfusion hepatitis was. It was indeed hepatitis C. And then we worked together to basically characterize the natural history of hepatitis C. And actually, there was some really good work done here in Ireland as well from a woman who had received ROGAM and had been infected with hepatitis C. So there was a big cohort. There was one here in Ireland and one in Germany. And these sort of 3 studies put together really the course of what happened to hepatitis C. And then the next step was to try to treat it. And in the early days, we were using interferon therapy, which was just horrible. Patients really suffered from taking interferon, and only about 7 to 10% were cured. And then the real breakthrough came with the combination of adding ribavirin to interferon, and then response rates went up to about 37%. And then they developed pegylated interferon, which took response rates up to 50%. And then the first direct-acting antiviral agents, after they basically identified the virus, then they were able to discover its 3-dimensional structure and all the various proteins, and then they were able to identify inhibitors of these proteins, and that led to the development of direct-acting oral antiviral therapy, which completely changed the field of hepatitis C. So I was involved in drafting the guidelines for use of these medications. So that, to me, that was very, very fulfilling. And now we can cure everybody with hepatitis C. So I went from not being able to cure a disease to where now we can cure everyone with a single pill for 8 weeks, which is completely amazing.
Yeah.
I don't think there's been any other achievement in medicine quite like that. And so for me, that was incredibly fulfilling. And to see patients who had been completely sick and, you could make them better.
Sure, yeah. I mean, your work on that is world renowned anyway.
No, I played only a very small part, but
yeah, I mean, what you do is pretty amazing. I mean, on 2 fronts. One is, I say, one of my close relatives has post-transfusion of Hep C, and when I hear about it, I say I didn't know what to do, and suddenly realized one of my best mates is doing this. Exactly. So I phoned the guy. He can tell me what's been going on, what's the treatment, who to see, and it's make my heart at ease. And to have friends like that and the different fields helps you. And 2 is that it's one of the biggest sacrifices in life, I think, that you self-destruct your own career. You spend your whole life doing certain thing and you killed it. And I say, okay, I better find something else to do.
You put yourself out of business.
I know, just say, I better get an employment benefit.
Yeah, that's right. Marc, you're a plastic surgeon. I mean, you look exactly the same as you were in college. You've trim and weld. I'm sure, just like what you said about the connections, I'm sure there are a lot of people who are well connected to you would ask you, what's the secret now, because of having a very good aesthetic as well as good quality life as you age.
But the funny thing in life is that I spend nowadays, as I get older, I spend half my life telling people, if you don't want surgery, don't have it. I'm actually talking myself out of business, because I think that's one of the things, is that prevention is better than cure. I mean, yes, I can pull you back, but it looked like the gentleman who was in the Olympic carrying the flag back to LA. I mean, I did not say it. I did not mention name. But the thing is that it's a little bit too tight, it's a little bit too fake. And so we're only human. We can't basically make you younger. I mean, prevention is the only way, basically. Have a healthy lifestyles and eat well, sleep. I mean, we all know that if you only sleep 4 or 5 hours, unless you're one special person, you are going to age much quicker. I mean, you don't exercise, your cardiac is not going to have enough output for your skin to rejuvenate. And then it's the principle is simple, but people don't want to know that. They rather spend £100 on a bottle of cream that tells you that, oh, wow, this is supposed to make you look younger. But if you look at the scientific data, you say, well, the dosage is 1,000 microgram per mil, but in the bottle it's 2 drops a mil. So, I mean, but it's marketing. I mean, we can
snake oil.
So,
right?
So, Marc, which cream do you use? Tell us.
You got to pay him.
I suppose that's the thing, isn't it? You have to pay it. Whether you use the cream or not, you still have to pay.
But I mean,
but everybody wants the
eternal youth, isn't it?
They want the fountain of youth, but they don't want to work for it. They want to take a pill and think that they're going to prolong life. But yes, the way to is a healthy lifestyle.
But I think
right?
that
So
message
exercise,
is getting through.
moderation, maintain your weight.
No, but I mean, that's the scary thing, is that if you think that the number of surgery in the whole wide world is pretty much the same with growth, with a little bit with population growth and people more accepting. But the biggest business is all the non-surgical, like Botox, fillers, and those things, and machines. Those are the things that's gone exponential. It's a multi-billion-dollar industry, which I don't touch because I'd rather still go back and operate and do reconstructive surgery, which was the reason why I went into plastic surgery, because I could cover someone's leg with a broken bone so they can still walk. I can rebuild the breast so they actually feel feminine after breast cancer surgery. But that side of the non-invasive is just scary, the exponential. People just don't want, they're quite willing to spend money, but they don't want any scar and they just want something that's quick.
But I feel that's something that we learned from college. I don't know if you guys remember, but I certainly remember it. The professor of forensics, when he gave us a lecture once, he talked about this very thing, right? That that you go into medicine for a purpose of helping people and not to make money. And I think that's something that's obviously stayed with us. Because I mean, to me, that's much more fulfilling. Unfortunately, there are a lot of people in medicine now who are trying to use medicine as like a business to make money, which I think is completely the wrong, use of medicine.
I think you're right. I mean, okay, cosmetic is there's money in cosmetic, but at the same time, it's just that my true belief is that if money is the only driving force, it actually make a very unhappy life, because you're never going to get enough money. There's never enough, and so why go for something? You might as well go and see some result in helping people, and they can go by walking, they're cured of Hep C, they can actually go and take their grandchildren on the beach because they can now walk more than two steps. I mean, those are the things that's more satisfying than anything else in the world.
That's right.
So we're all right about the peak of our careers.
Exactly.
And
which is a good thing.
Yeah. So what's the next phase?
We're starting from
The next phase. Well, we are here for the alumni celebrations. So today, I think there's the gala dinner after that this evening, and I suppose you have to keep in good tradition for a
to collect his. to collect his prize.
Oh yeah, that's right. You have something to collect later on. So we shouldn't actually hold this up too much.
But what's the prize is the Guinness. If anyone was interested. But what's
shaped and delivered in a special form.
What's next for your career, Dave?
What's next for my career? Well, I would like to continue with the teaching and the education for a little while.
Okay.
And then after that, slowly wind down completely to playing more golf and traveling and swimming.
So any plans for retirement in the near future?
Oh, sure. Within the near future, over the next 3 to 5 years, for certain.
Really?
For certain, yeah.
Okay.
I think I've worked quite a long time. And now I think, like what you were saying, which was that you came. One of the reasons why you came for this reunion is to try and connect when we are still in good, well shape. I know you guys run quite a lot and exercise quite a lot. I try to do that too, and I think that message of actually
lifting a pint is not exercise. Let's not get that right.
That type of exercise.
That type of exercise is only good for 1.5. So.
Okay, you got me there too.
And now you have, we haven't talked about, well, Marc, how about you, and then we'll take it somewhere else.
Well, actually, I don't think I'm planning to retire. I mean, my work is not as intense as his, and I think one of the nice things of being a doctor, instead of working in the corporate world, I can cut down and still function. So I can do sort of 3 days a week rather than 5-6 days a week, and I still like what I do, and I really do like operating. And my intention in the next few years is to maybe spend a bit of time with my poor suffering wife, just to go do a bit of holiday, and maybe, as you said, I'm linked with some charity. Maybe I'm going to do some charity work, because the British Association of Plastic Surgery, we saw it go to Guyana or Zimbabwe or quite a few places. So, and then Vietnam. So we have some connections. So I may be doing a little bit more because now I have more free time to go and do that. So that's another new chapter, doing something that I know well enough to do and still get the satisfaction out of it and no stress.
Yeah, that's wonderful. I mean,
And what about you,
I
Marc?
think I told you guys that I probably still plan to work for at least another 15 years because we both still have young kids.
Yeah.
And unfortunately, education in America is very expensive. And, you know, you have to save up and pay for them. Maybe some might want to come to surgeons. So, you know, so
I thought you were asking her to donate to crowdfunding.
No, I intend to work. And of course, I enjoy my research. So I'm doing more now with hepatitis B. That's my sort of, you know, big goal to try to cure hepatitis B. But that's going to be a tougher nut to crack. But we're going to give it a shot and see where it goes. But I guess we've been talking a lot about our careers, and we haven't really touched on our personal life and our families. So Dave, you have 3 kids,
Yes,
right?
yes,
and,
I do.
Tell us a little bit about what your kids would like to do now.
Well, my kids are all have their own mind, and they have their own ambitions and their own outlook on life, and I'm fortunate that they actually are very independent. And I think whatever they choose to do, one at the moment is doing computer science and engineering.
Okay.
One is doing law, and the third guy hasn't decided what he wants to do just yet. So whatever he chooses, I think they'll all be fine. I think we have talked quite a bit. It's been a real pleasure. You know, we've had a great time.
We can hear about Marc's
Yes.
family.
No, you don't need to. I mean, I've got 2 kids. One just literally got his result on Thursday. So he's going to uni. He's going to do economics related work. And my daughter is going to do A-level next year, and she wants to do medicine.
Oh,
So
very
she,
good. Oh,
yeah, she may still want to come to surgeon. I don't know what she wants to do. Yeah.
That's great.
Excellent.
Yeah.
Make sure she doesn't trip coming
I
down
know.
the stairs.
Yeah, but if that's the best way to meeting your friends for the rest of your life, to have your best friends that way, I think she should trip.
Since we started with the trip and ended with the trip, I think we should now call it a day. Yeah. It's been a pleasure and
It's great to talk to you guys.
Yeah, thank you very much.
It's
and
been wonderful.
And a big shout out to all our friends of the boys who couldn't make it for the reunion this year.